Pseudophakic photic phenomena, or PPP, photic phenomena, or dysphotopsia, refer to perceptions of light anywhere within the visual field. The unwanted light images, either transient or permanent, are often reported among patients who have undergone uneventful cataract extraction with IOL implantation. Although reasonable, the definitions of dysphotopsias and their true causes are based more on conjecture and anecdotal reports than hard clinical evidence. In this video, we will present a case report of a patient with a complaint of a severe positive photic phenomenon managed with piggyback IOL implantation. The patient is a 64-year-old female who underwent uneventful phacoemulsification with an implantation of a one-piece PMMA IOL with a round optic of 5.25 mm, rounded edge, unequal biconvex design, and a 10-degree haptic angulation. On the 1-month follow-up visit, she complained of washed-out vision that was constant throughout the day, only in this eye. Here we have an illustration of the patient's visual perception made by herself. Post-operative best-corrected visual acuity was 20/20. The slit lamp examination was remarkable, only for a slight posterior capsule opacification. The IOL was centered within the capsular bag, and its edge was covered by the capsular rex margin. When we compare it with the fellow eye that had a silicone IOL implanted, we could notice a much larger space between the IOL and the pupillary aperture. She underwent YAG capsulotomy on the assumption it was the cause of her symptoms, which unfortunately persisted. A new BM examination of both eyes showed a centered IOL completely within the capsular bag, but the anterior chamber was deeper in the eye with the PMMA lens. Panacam image showed pretty much the same findings, although we obtained more precise measurements of the anterior chamber depth and the relative position of the IOL with respect to the iridoll plane. In 2000, Erie and co-workers demonstrated through ray tracing models that an unequal biconvex design with a higher refractive index material like PMMA increased the relative intensity for reflected light at the retina 300-fold. In 2005, Ernest published a case report describing a patient with bilateral acrylic implants with a severe photic phenomenon, also described as washed-out vision, which was also corrected with piggyback IOL implantation. He speculated that this effect could have arisen by the eccentricity of the capsular rex's edge with the IOL optic, and that the nature of the complaint was a combination of a normal positive dysphotopsia compounded by an extremely sensitive patient. Unfortunately, the literature does not help much, since it has speculated that PPP may be related to various factors: optic edge, optic material, optic size, larger pupil size, centration with the capsular rexes, corneal surface quality, change in the exposure of the retina to different wavelengths of light, vitreous change, posterior capsule change, and multifocal IOLs. The patient underwent uneventful piggyback implantation of a one-piece PMMA lens with ovoid optic with corneal paired incisions intended to correct her astigmatism. On the first post-operative day, she reported that her symptoms were gone and she had a best-corrected visual acuity of 20/25. Implanting the secondary IOL in the sulcus probably altered the light distribution to the primary lens, resulting in less reflected light reaching the retina. The patient's complaint was constant and did not show diurnal variations or weather-related changes. Her symptoms could also have been aggravated by the fact that a silicone lens was implanted in her fellow eye. The UBM and Panacam studies performed before and after the piggyback implantation display the shallowing of the anterior chamber, mimicking the natural position of the crystalline lens as in her fellow eye. Therefore, we would like to speculate another cause, adding it to the list of probable cause of dysphotopsias. Relative position of the IOL to the pupillary aperture. The exact mechanism of this uncommon dysphotopsia in this case report is unknown and probably is multifactorial. As in Dr. Ernest's case, the extreme nature of the complaint was a combination of normal PPP compounded by an extremely visual and sensitive patient who happens to be an artist. This case also illustrated that implanting a secondary piggyback IOL in a piggyback fashion in the sulcus can successfully treat severe pseudophakic photic phenomena. Until the unsolved issue of unwanted image is elucidated, we should consider performing piggyback implantation, since it does not have the same potential inherent risks associated with an IOL exchange. It must also be remembered amidst the discussions of photic phenomena that even though unwanted images are fairly common in pseudophakics, the incidence of debilitating persistent problems is low, and most patients report being happy with the surgical outcomes, even with unwanted PPP. Thank you very much for your attention.